Face masks have been proven to slow the spread of airborne germs like COVID-19, but are all face masks created equal?
Suzanne Stratford has an eye-opening report that puts some of the most popular styles to the test.
For decades, medical microbiologist Dr. Hazel Barton's worked on everything from HIV to subsurface cave microbes.
So we've covered a lot of the big emerging viruses.
The facial coverings we're testing include a 2-layer t-shirt design, bandana, single-layer cotton, a microfiber neck gaiter, surgical mask, a neoprene and cotton mask, a valved N95, and regular N95.
With any respiratory disease, the trick is that you've got to stop breathing it in.
She says most coronavirus seems to be spread from coughing and something called super spreaders. Basically, people who don't know they have it.
Most of the protection we get is not you not filtering it in, it's the people that have the infection not pushing it out. And so they actually get trapped in the material of the mask.
For our test, we're using smoke.
And these droplets that we're coughing out, the ones that make us sick are much bigger than that. But the smoke particles you can see.
Both the 2- and 1-layer cotton masks allow a wisp of smoke to escape, but it remains close to the face.
Droplets are going to be, a few dozen as opposed to probably 2 or 3 million particles of smoke.
With the neoprene and surgical masks, a little smoke shoots out toward her eyes, but she says that's likely due to fit.
It's not the droplets, and I'm not coughing, right? Can you imagine me right? It would be right here.
Now watch the bandana, neck gaiter, and valved N95. Here it is again. Watch as the smoke blows through all 3.
The smoke looked terrible because the smoke is so much smaller, but certainly I don't think I would ever wear one again with at least having it doubled up.
Finally, we see why the N95 respirator is the go-to for medical professionals and first responders.
Nothing. Oh my God. Whoa.
Duke University researchers recently published remarkably similar results from their experiments tracking actual droplet particles released from a person's mouth. The CDC recommends masks with 2 or more layers and also advises against gaiters and face shields at this time. N95s too, but because they're intended for healthcare workers.
This really gets to show you how dramatic it can be because smoke is a good way of showing that. But if you can't see the smoke, then you're definitely not going to be able to see the particles.
But she says any covering is still better than wearing nothing and will offer at least some protection. This test just shows why social distancing is also so important.